Medical Monday this week, we have Danielle Rogers in. She is a nurse practitioner at Coliseum Medical Systems. And Danielle, thank you for being here.
Thank you. It's my pleasure.
All right, and what we're talking about today, kind of a cool thing. It's about genetics, and you do something special called genetic counseling and testing. This is a way for families to figure out if you are at risk for certain cancers and different types of stuff. So how cool is that? It's kind of a cool thing.
Oh yes, definitely. I mean, being able to sit and evaluate, individuals and their families who may be at risk for certain cancers, the counseling aspect is more to try to identify patients who may meet criteria for testing. Once we identify those individuals, the focus is trying to prevent these cancers altogether. So it gives us an opportunity to kind of educate them about, what cancers they may be at risk for, and then what their options are to reduce that risk or even prevent these cancers from happening.
Oh wow, very cool. So you kind of see the future a little bit. That's very cool. All right. So I guess obviously there's a lot of science behind it and things like that. But if you can you break it down exactly how the process goes?
Oh yes, absolutely. So typically a patient is evaluated by their provider. What we're looking for are specific cues. So obviously we want to evaluate that individual's personal history, especially if they've had a diagnosis of cancer. The next thing we look at is their family history. Obviously the family history can give you much more insight. We're looking for certain cues, whether there's a clustering of the same type of cancers in the family. So 3 or more women with breast cancer, or 3 or more family members with colon. We also look at the ages of onset, because typically with these hereditary cancer syndromes, the onset tends to be much younger than what we see in the general population. And we're also looking for rare cancers, so male breast cancer, ovarian cancer, or multiple cancers in one individual.
Okay, all right, very cool. And I guess the best part for you is to see these families. Can you talk about some of the reactions?
Well, I mean, obviously getting a diagnosis that you have a genetic alteration or mutation can be quite distressing. And, counseling these patients and individuals and families, you do have to overcome a lot of psychological barriers. However, sometimes having this information up front can be quite empowering for these families, because obviously the focus is prevention. And if these families have the opportunity to know their risk up front and try to make choices that can reduce their risk, it definitely gives them more options.
And how can we get involved?
Obviously if you are suspicious of your family history or concerned, you can definitely contact your provider. Your provider can refer you to a genetic counselor there's multiple areas obviously here in Macon, and then of course be evaluated. Not everybody meets criteria, and typically we can only account for about 5 to 10% of cancers to be associated with genetic mutations right now.
All right. Well, Danielle, thank you so much for being here today. A lot of good information out there, and we'll have more information about genetic counseling and what you can do on our website, 41nbc.com. And coming